Right. Hello, everyone. Welcome to the 2023 PAIMI PPR and ACR webinar for October 17th, 2023. I am Crystal Pender. I will be assisting with this webinar. I have with me from the WebBGAS support team, Clarence Whitley, who is a business analyst and trainer on the team, along with Charlene Carr, who is also a business analyst on the team. All three of us will be helping to walk you through the webinar today, along as we have Lisa Stallsworth as well. Before we get started, we are going to go over a few housekeeping items. This webinar is being recorded. This webinar will be sent over to the SAMHSA YouTube page for viewing at a later date. Live captioning is available for this webinar. A link to the live captioning is in the question and answer sections of this webinar. And just so everyone knows, everyone has been muted. The chat has also been disabled. If you have any questions, please submit them via the question box, as there will be a Q&A session during the webinar. And that Q&A box is at the top of your team screen. Should be directly next to your people icon or somewhere along there. You should see chat, Q&A, people, option maybe to raise your hand or so. But at the top bar of your team section is where the Q&A section is. And again, that has that link to the live captioning stream as well. All questions that you have regarding the data and what is to be entered should be directed to your contact at SAMHSA. Now, before we go ahead and get started, I will welcome Lisa Stallsworth as she goes ahead and gives us some introductory words.
Hi, good morning, everyone. I am Lisa Stallworth, the PAIMI Program Coordinator. Thank you for joining today's webinar to review the PAIMI Program Performance Report, PPR, which includes the Advisory Council Report, ACR, for the fiscal year FY 2023. FY 2023 PPR and ACR is a new form for 3 years and expires on July the 31st, 2026. The PPR and ACR is due in WebBGAS by 11:59 p.m. Eastern Daylight Time on January the 1st, 2024, in accordance with the PAIMI program statutory requirements. The purpose of today's webinar is to navigate through the PPR and ACR, point out changes and new information added to the reports, and ensure the requirements for the data entries are clear. If there are items in the new PPR and ACR that you do not have data and information for it, please provide a statement in the footnotes at the bottom of the form to let us know this. When the opportunity is given during the webinar, please feel free to ask questions. You may also contact your assigned PAIMI program officer by email with any questions you may have while completing the PPR and ACR. In addition, your program officer and I are available if needed for a team meeting to help you. SAMHSA would like to thank you for the protection and advocacy activities and services provided to PAIMI eligible individuals during FY 2023. Now we'll turn the session back over to Crystal. Thank you so much for your attendance.
Thank you, Lisa. I'll go ahead and let Clarence begin the webinar.
Good morning, everyone. Can you all see my screen right now?
No, I don't see it, Clarence.
How about now?
Yes, we do
Yes.
now.
Okay. Good morning. I'm Clarence Whitley, as stated before, and right now we're going to jump into how to navigate the WebBGAS webpage. I must first point out that we are using our UAT system page, which is our test site. So all the data that you see is not real data, but it is very similar to what you'll be using on the WebBGAS.gov page. So first, once you open the page, you will come to the home screen where you must enter your username and password. If you do not know your password, you can select the forgot password or the forgot username. If you need a new user account, you can select this option here, and you will be given instructions on how to receive a username and a password. Also on the home page, if you need any assistance with navigating through the WebBGAS system, you may contact us through email or a support ticket, which goes directly to our help desk. You can also contact us at 1-888-301-BGAS. Please remember, this is only for help navigating through the system. Any other questions that you have about BGAS, on what data to enter or anything like that, you must ask your supervisor. We cannot provide you with any of that information. Okay. Once you log into the WebBGAS system, you will be brought to this screen. This is our window shade. The window shade houses any information that you will need pertaining to WebBGAS, such as help, any notes that have to be mentioned, or if the system will be down. This is where you will find all of that information. And to close this screen, you just simply select the screen and it will disappear. Now, once you close the window shade, you will be brought to the WebBGAS home screen. And from this page, you will have the option to create a new application, view existing application, run a report, change user password, or once again, contact the help desk. You can also view state protection and advocacy agency state contact list and profile from this as well. Now, I would like to point your attention to the top of the toolbar. I'm going to put out a few things up here. One of the main important things that we have here is the support tab. Once you select the support tab, once again, from this screen, you can create a support ticket, which allows you to contact the help desk, and also trainings that we have. For the purpose of this webinar, I'd like to point out the PAIMI application tutorials, where you have the Grantee PAIMI application tutorial here and the Grantee PAIMI program performance report tutorial. So you can download these and save them to your computer to help you navigate through the application. Next, you will go back to get out of that, you will go back to the WebBGAS icon at the top. It'll bring you back. And now we're going to get into the application.
Clarence, is the
Yes.
view at 175?
1 second.
Okay, that's better. Thank you. Thank you.
Okay. Now, it is very important before you create a new application to come to the toolbar and select the state P&A profile. My screen is a little different than yours because I have administrative rights, but yours will come up with your state. For the purpose of the demonstration, I'm going to be using Wyoming. It will automatically come up for you. Now, once you're in this screen, this is all the information that we have that you have entered before from last year. It has not changed. But if anything has changed, it's very important that you do it from this screen before you create a new application, because all of this information will be ported over to the application in the general information section. So if you need to make any changes, feel free to do it here and do it now before you start the application. Okay. Now we'll go back to the state of Wyoming that we'll be using. Once you have edited your state P&A profile, it will be brought to the existing applications option, the application dashboard. You have the option to create an application, and once again, the option to go to your state profile page. So now let's get into the 2023 PAIMI progress report. Here is the State of Wyoming dashboard. From here, you have the option to view the application, and also you will see any recent activity that was done to the application. Also, at the bottom of the screen in the related documents, there is a PDF version available for download of the PAIMI ACR for the year 2023. So you can download that there if you want to, or which I'm going to show you later, you can do it from within the actual application. Now, before we move on to the actual application, do we have any questions? You have any comments, Lisa?
No, we're good.
Okay. Let's move on to the application. Once you get to the application, it will bring you here to the overview screen. This is the entire application for the year 2023. I want to point out something very important. This is the attachments tab. If you have any attachments or supported documentation that you need to upload, you can do it in this section, or you have the option to upload within each section of the application. So I just want to point that out for you. To access the application, once again, you can do it from the complete overview screen, or you can select each section and do it that way. Also, if you select by each section, it will give you the ability to print a portion of the application. Okay, let's get into the general information page. This is the information that was ported over from the state information page. Everything that you had put in there should be here, but if you made a mistake, you can edit this information here and be able to put in any data that you see fit. So don't worry if you forgot to check the state P&A page. You can still come back and do it here and save it. Also, I would like to point out that you can also print the document from here as well as add footnotes. And once you've checked all of this information and it's correct, once again, you save it. And to know that you've done it right, you should get the following message up top that the form was successfully saved. And once you have completed this page, it's very important that you mark your form as complete, and you will see the status bar update. As you can see, 3% of the application has been completed and 16% of this section. Moving on to the second one. As you can see, there's a new title. It is now called Demographic Composition of PAIMI Governing Board, Advisory Council, and Program Staff. That was a change that was made this year. Also, under gender, we added the transgender, trans woman category, the transgender, trans man, the two-spirit, gender non-conforming, other, and please not to prefer not to say. Those were categories that was added this year, as well as sexual orientation is a new part to the table. So please, when you're filling out your forms, do remember that these are new categories. And everything must be filled out. If not, if you leave anything blank when you go to save, you will get an error and the box will be highlighted red to let you know that there must be a value in every field. So if you don't have anything, you can just put a 0. And it will save.
So I have a comment once you finish here. When you finish.
Go ahead.
All right. So just want to make sure that everybody remember that even though you have the different categories for the boxes, the numbers should all add up to be the same once you complete those boxes. The numbers should be the same once you complete all the boxes. Thank you, Clarence.
Moving along to governing board. Okay, once I have already entered data for this for the purpose of the exercise, but these will be blank once you open. And this is a clone of last year's page. The only things that we have updated is the years to reflect 2023 here, as well as here. Other than that, this page is completely the same. And once again, be sure to mark your form as complete once you have verified and filled out all your information. Moving along to the executive director, no changes have been made to this page. Just please make sure everything is filled out properly. Once you have filled it out, make sure you save. Once again, if you filled it out correctly, you will get the form was saved successfully and mark it as complete.
Also, if I make a comment here,
Yes,
where
ma'am.
it shows the initial appointment date, recent performance, date of previous, please double check those numbers. Sometimes we get them, and again, it doesn't it's not complete. So just please double check those numbers and make sure that information is accurate. We do know that we've had recent a selection or hiring of new EDs. So again, please make sure you check this information. It's not based on what was submitted last year. Thank you.
Okay, moving along to number of mental health professionals. There was no change to this category as well. Once you open it, it will be blank. Just please make sure you fill out all the selections and save it. And once you have saved it, you're going to mark it as complete again.
There was one change. Remember, Clarence, under other, we now have in parentheses to please identify what professional category when you identify someone in others. So in this example, there's 3. So we're asking that you will put in the footnote, and you will see this in the live PPR. It has a parentheses, please identify in the footnote who the others are.
Thank you for that, Lisa. You're absolutely right on production. It is corrected.
Okay. Also, too, I think I need to go back to that real quick because this was a question that came up last time.
Okay.
All right. Go back to the so again, this is only for your PAMI Advisory Council. So you're identifying of only for the PAMI Advisory Council, their profession, if they fall in one of these categories, and then if they fall in others, as we say, identify. Only for the PAMI Advisory Council.
Okay, moving along to the PAMI Advisory Council. We did add the assisted staff to the end of this title. And this, once again, other than that, we have added the ethnicity row, Hispanic/Latino of any race, non-Hispanic Latino. And we've added 2 or more races as well as some other race. We've added these rows. So please fill those out accordingly. And once again, all fields must have a value with them in order for you to save and move on with the next part of the application.
Also, keep in mind that ethnicity and race, those numbers should add up.
Okay, that was section A. Are there any questions that we have right now? Please remember, if you have any questions, to place them in the chat box. Okay, moving on to section B. Demographics interventions on behalf of PAMI individuals.
I apologize, Clarence. We actually did have a question.
Okay.
Question, will you be sending out a document that contains a comprehensive summary, all of the changes for the new PPR, so that we are able to update our case management systems accordingly?
No, we can consider that, but that's something we have not thought about. So at this point in time, that's something we have to consider, but not at this time.
Okay. And then Clarence, could you please make the font larger? Yep, thank you. Those are all the questions that we have currently.
All right, thank you.
Okay, moving on to Section B, demographics. The first table is population information. There have been changes made to the population information. We have it separated by age, gender, and sexual orientation of PAMI eligible individuals served. Will be added to transgender, trans woman, transgender, trans man, two-spirit, gender non-conforming, as well as sexual orientation. This is also new. So please take notice of all the new fields and the new table that was added. This is different than last year.
And also remember that it should all add up. Each of the different tables should all add up.
And also, when you put it in your percentage, you have to have a decimal with 2 places behind it. That is very important. Once you've done there, I'm going to click the Save button and mark it as complete. Moving along to PAMI eligible individuals served with PAMI program funds. We've made one change here to question 6. It now reads the total number of PAMI eligible individuals who requested program-related advocacy services during the reporting year, but were not served within 30 days of initial contact. And you have the choices of A, insufficient PAMI program resources, or B, non-priority areas. That is the only change that was made to this table. And please also make sure that you're reading the instructional text at the beginning. It'll give you instructions on how to fill out the form to make sure that it's done correctly. Also, question 7, there's a slight change that was made. Individuals served as of September 30th and will be carried over to the next reporting year. This should equal less than item 3 above. Okay, once you've done, let's save it and mark it as complete. And remember,
Also,
if anything's not, go ahead, Lisa, I'm sorry.
No, go ahead. I'm sorry. Go ahead, Clarence.
Also remember, if it's not filled out correctly, that you will get an error to let you know that something's not right. So go ahead, Lisa.
So where you see the instructions in the live or the one that's in production, there will be specific instructions for each of these forms. So please click on the instructions and you will see the instructions have been added.
Moving along to.
Just want to make sure I reiterate, if you have any questions, please make sure you put them in the Q&A section, as that will be the only way that we will be responding to the questions. Sorry, Clarence, continue.
Okay, living arrangements. This is a clone of last year. There were no changes that were done. The only thing that was changed was clinic was added to the selection. Other than that, this form will remain the same from the previous year. And all of these boxes should add up to the number below. Once again, no changes have been made to this. So once you've entered your data, because it will be blank once you open it, save it and mark it as complete.
If I may make a note here as well, Clarence. So if you identified in the previous form that you served 50 people, PAMI eligible individuals during the year, then when you get to living arrangement, we'll be looking for that same total number of people that will be distributed throughout these different living arrangements. Thank you.
Okay, that takes care of Section B. Do we have any questions around Section B, demographics? Okay, moving along to Section C, complaints, problems of PAIMI individuals. The first section is areas of alleged abuse. As you can see, we've added more categories to the outcome key. The outcome key is here to make sure that you know what outcome you're putting there and have it in the appropriate place. So you're going to use this key to fill out these appropriate outcomes. And the outcomes that were added were E. This is new. Other indicators of success or outcomes that resulted from P&A involvement. That is a new category. Along with H, P&A withdrew due to conflict of interest or other reason. These are two new categories that have been added. Once again, every field must be entered before you can move along and save the application, save the page properly. And you must also enter at least one test case per page. If you need to add another test case, simply click the Add New Test Case, and you will have it down the bottom.
Again, I just want to make a comment here. When we're starting to talk about adding the cases down at the bottom for examples to demonstrate the work that was done in this area. Again, please remember that as SAMHSA, as the program officer, we are looking to make sure that this case is a case that would definitely be allowable under the PAIMI program. So again, please provide enough information for us to make that determination. If it's from a facility, the person was in a facility at the time of intake or the time that this case was taken on, please indicate that. If you don't, if the person was in the community, again, please provide specific, a specific mental health diagnosis so that we can determine from that as well. But again, as we have said many times before, please provide enough detailed information for us to make the determination on our end that this is indeed a PAIMI eligible case. Thank you so much.
Thank you, Lisa. Moving along to neglect. Once again, the outcome key has added two new selections, the same as it was an alleged abuse. And also down the bottom, we've added a better explanation, the total number of neglect complaint problems addressed from closed cases. So we just want to point that out that was added. And once again, you must enter at least one test case. Moving on to rights violations. Same thing again, two new categories were added to the outcome, P&A, withdrew, and other indicators. Same two, once again, were added to the outcome key. And we also have some new selections starting at N, failure to obtain informed consent. That is the new option. Advanced directive issues, the denial of parental/family rights. Housing discrimination, the denial of access to administrative or judicial process. Those are all new selections that have been added. Once again, please make sure that every box is completely filled out. If there's no response, put a 0 in order for it to save. And once you save, go ahead,
Oh,
Lisa.
I'm sorry. Go ahead. No, go ahead. I'm sorry.
No, I was just going to say, once it's saved, just mark it as complete. But please.
All right. So I wanted to acknowledge that the information that you do see as changes or information that has been added to the new PPR were the recommendations or suggestions that were made based on the public comments that we received during the process of going to OMB to have this PPR and ACR approved. So these are comments that were made or recommendation that was submitted to SAMHSA. Either many of them came from the P&A as well as from NDRN. Thank you, Clarence.
Mhm. And also, once again, please make sure you add at least one test case. Okay, moving on to individual advocacy case files. We also have some new selections here. 1, 2, 3, 4, 5, 6, 7, and 8 are all new selections. Client's objective was partially or fully met. Number 2, case or investigation lacked merit. Number 3, case withdrawn or terminated by the client. Number 4, issue favorably resolved. Number 5, issue not favorably resolved. 6, other success or outcomes due to P&A involvement, i.e. provided self-advocacy assistance. And also services not needed due to client death or relocation. I'm sorry, I skipped over other representation found. Those are all new selections for this page. And as always, please enter one test case at least.
So here, Clarence, based on the number of cases that were identified for abuse, number of cases identified for neglect, and the number of cases identified for right violation, this form is a summary of those 3 types of cases. So the total number at the bottom should equal to the total sum of the 3 for abuse, neglect, and right violations. And we do look to check for that.
Okay, moving along to intervention strategies. Okay, for this one, once again, we've added selections to the outcome key, selection E and H, as well as the outcomes. We've added an abuse table, neglect table, and rights violations. So all of this. Go ahead, Lisa.
So on this form, we do know that a case could have more than one intervention. So we do understand that. So say, for instance, with abuse, in the previous form for abuse, you identified 20 cases. But then when you get over here to the outcome to show your intervention strategies, you may have 22. If that is the case, that's not a problem. Just drop us a footnote, just drop us a statement or something in the footnote so that we will understand why there's a difference between the number of abuse identified in the previous form and then based on your intervention strategies. It's not a problem. Thank you.
Moving along to death investigation activities. We've added to this one the number of deaths reported to the P&A for investigation by the following entities. So that is a new little instructional text for you to give you some clarification of what to put. Also, for selection 2, we've added if 0 means the P&A did not receive any death reports from CMS for the investigation, please note this in the footnotes. And here is going to be the total number of death investigations. Down here, we're going to have the number of deaths investigated. It's going to be a sum of 9B 1 through 6. And once again, please enter your test cases down below, at least one.
All right, Clarence, when we go back up to the second one, we just want to let you know we have made some contact with the Center for Medicaid and Medicare Services about this situation with their regional offices reporting to the PNAs any deaths that were reported to them from any facility. So we have reached out to them and have made some making some effort for that to be corrected. So just want to let you know.
Thank you, Lisa. And moving along to number of interventions on behalf of groups. This is a clone of last year's page. Nothing was changed. The years were just updated to reflect the current year. Other than that, this page will be just like the previous year that you filled out.
Okay, so this is a page that we, over the past couple of years, have had many revision requests. So just for clarification and understanding again, so when you look at the number 3, it says total group cases project worked on during the year, add 1 and 2. So let's go down to number 6, Clarence. Then it says at 6, the total number of individuals potentially impacted by line 3. So with that being said, you have the number from line 3 is the total projects or cases. Then here in 6, it says the number of people. So this form at the bottom should be a reflection of the information in line 3 and also the potential people, number of people in line 6. Those are the numbers that we're looking for. So go down a little further for us, Clarence. So in that first column should be the number of people from line 6, and then the concluded successfully, concluded unsuccessfully, ongoing are the number of cases that should equal back up to line 3. Say that one more time. In that first column, in this form at the bottom, the total number should equal to line 6 at the top, and then going across, concluded successfully, concluded unsuccessfully, ongoing. Those 3 numbers should be a sum of what is in line 3. If you still have some problems while you're completing this, please let us know, and we will go back over this again, because we did have many discussions here with some of the PNAs. But that's what the results should be at the bottom, based on line 3 and 6. Thank you, Clarence.
Okay, moving along.
If you have a question, ma'am, put it in the chat.
Performance measures of PNA activities. These selections have all changed or been updated. So please read carefully because they are different than last year. Everyone is a new selection. Once again, once you open it up, it will be blank for you to enter your information, but please read carefully because these are not the same selections as last year. Okay, that concludes section C, and I feel that we have some questions.
Yes,
right.
we have quite a few questions. First question that we have, I'm confused. Is the number of clients carried over not included in the number served during the year?
Okay, so you have the total number that you served, yes, but you may not have completed the work, because in the PPR you're only reporting closed cases. So if there are cases that of people that you started to serve in the year, but you carried them over to FY 2024, yes, they would be a part of that number. Next question.
Since the DAD system has not been changed to reflect the PAIMI PPR changes, should we just use zeros? Also, the DAD system still does not reflect the changes you want. Will there be communication with NDRN so those changes can be made for fiscal year 24?
Okay, so your contract, your system with NDRN is between you and the PNA. That will not come from SAMHSA. So again, we will not communicate this with with NDRN because the system that you have, the DAD system, is between you and NDRN.
All right. And there is another question around that one asking, is NDRN going to provide guidance to P&As?
No, NDRN does not provide guidance on the PAIMI PPR ACR. They do for the one PPR with ACL, but they're not responsible for the SAMHSA WebBGAS.
Next question. I'm new to PPRs, so please excuse me if this is something I should know. I have concerns about having new outcomes added now and not having tracked the new added outcomes all year. Can you provide any guidance to that?
As I said in the beginning introduction statement, if there's information that you have not collected due to the changes in the PPR, just please make a statement in the footnote that this information had not been collected. So, but as you're going forward in this year, you should consider collecting this information. So that is understandable.
Okay. Next question. If all performance measures have changed, do we just enter 0 for all the performance measures that we tracked for last year?
If you did not track a particular outcome measure, of course, use 0.
Okay.
Only record what you have.
The other indicators of success outcome, would that include an outcome that wasn't specifically an objective of the clients at the start, but occurred anyway as a byproduct of the P&A's advocacy?
Okay, repeat that for me again.
Sorry. The other indicators of success outcome, would that include an outcome that wasn't specifically an objective of the clients at the start, but occurred anyway as a byproduct of the P&A's advocacy?
It could be. Yes, it could be.
Okay. Is the information about which forms have to have numbers that add up included in the instructions for the form?
No, some of it is just because you basically you just reporting this same information in different ways. So no, it may not specifically say it in the instructions. In some places we do say it, but again, you're reporting the same information just in different forms, and so it should equal all up together.
Okay. Under the strategies for abuse/neglect, I didn't see investigation there. Did I miss that?
Yes, you missed it because that was a key thing that we added. So we can go back over it and make sure that you see it. It should be in the intervention strategies. If Clarence can open that back up.
Yep.
Go down. Abuse is number 5, neglect investigation. They're all the same. Yes, that was something that was told, asked us to add 2 years ago, but we had to wait until we do the new PPR to do it. And I probably know who asked that question.
Okay. Is that information that you just provided available as part of the instructions, or is that explanation written anywhere?
About what?
This came in 2 minutes ago, so I'm assuming that this refers to, not exactly sure. If you could put what this refers to around the information that just came in. I apologize about
Okay.
that.
So,
And go
so
ahead.
if there's something that it's still not clear once you go through, because once you go through the instructions, some of this may be a little bit more clear, but if it's not as clear as needed to complete the forms, as we said, please reach out with a question by email to the assigned program officer, and we will make sure that we respond so that you will have the clarification.
Awesome. Next question, can you please show the outcomes chart again?
Okay, Clarence. And again, all these outcomes was, again, remember this information is what came from the PPRs during from the public comments that we considered and added to the new PPR. These are your recommendations and suggestions. So the outcome.
Sorry.
Yeah. Okay.
I noticed that investigation type intervention is still missing from the intervention section. Is this correct?
What is missing from the intervention?
Investigation type intervention.
I'm not sure exactly what they're looking for. Please send me an email directly to me to follow with that question.
All right, next question. The number of people potentially impacted in that last section is for the total, right? For example, there is a monitoring line. We are supposed to put the total impacted by all projects in that category. So if there were 34 monitoring projects, we add how many people for each and put that number for people potentially impacted.
Again, yes, how many people that you determine were impacted by that? What method you use for that? Again, we do not particularly prescribe that, but yes, that will be the number. What number that you determine based on the population that will be impacted by it.
Okay. I believe that we have answered all of the questions that have come in so far.
Someone wanted to go back to the outcomes, the performance measures, the outcomes, Clarence. Yes. For the one that asked the question, is there anything in particular that you were looking for or you have a question about? For the sake of time, we're going to move on because it looked like we only have 15 minutes left. Am I correct? Okay.
Okay, moving along.
Mhm.
Section D, non-client directed advocacy activities. There was no updates made to this. This is just like it was in the previous years. Please make sure everything is filled out correctly. And once you're done, you're going to mark it as complete. And moving along to grievance procedures. Section E, once again, there was no updates made to this page. Everything remains the same. You're able to upload any documentation that you need to. Add a person if need be to identify all individuals. Save it and mark it as complete. Moving along to section F. Public comment. There were no major changes done to this one as well. All the questions read as they did last year. Just fill it out accordingly. Save it and mark it as complete. As well as the impediments, there were no changes made to this one as well. Completely like you've done in the previous years. So enter your text in each box, save it, mark it as complete.
I do want to mention that we do look at the impediments as well as the accomplish and recommendation and training needs.
No changes made to the accomplishments as well. Same as all previous years. Same functionality to upload. Gotta save it and mark it as complete. Now let's move on to the budget. The PAIMI budget, the instructions have changed, but they're still in the big bold red Texas. But it has changed. And also for section 1, this is for supervisors. Those will be the only people who will be allowed to make changes in section 1, but 2 new positions have been added to the drop-down box, which are vacant positions and volunteer positions. So now you have 2 new choices there. Also, we have a column change that now has the total PAMI share and percent level of effort to PAMI. Those were changes made. And if you scroll down a little further to other expenses, you now have the option to select litigation. Once again, the carryover for fiscal year has been updated to 2022. And also, you have the option to upload your budget. All right, Lisa, anything you want to point out on this page?
Yes, go back up to the line about consultants, because we get a lot of questions about contractors, consultant costs. So here, as the instruction said, any subcontract that exceed the 25,000 must be approved by SAMHSA Grants Management Officer, which comes through us first, because we are responsible as the PAMI program officers for reviewing and approving this budget. So here, what we will do is we'll go back to your FY 2023 PAMI application, and we are going to look and make sure that the cost that you have included in the budget, from personnel all the way down to indirect costs, is consistent with what we approved in the budget. If there's any change or difference, we will send a revision request asking, for a response. But when it comes to here, if we've already reviewed, if there was a contract, the total cost exceeded 25,000, and we've already requested when we reviewed the application, approved the application, we're not going to ask for it again in the PPR, because the PPR is a reflection of what you did based on what was approved in your PAMI application. Also, go back up to the top to personnel. The reason that we added the drop-down box for vacancy, because again, if there was a position that you did have a budget in your application, but for whatever reason, the person left or you never hired the person that you intended to hire, again, please make sure that it's clear that no cost was incurred for a position, and you can indicate that that position was vacant. Go down to the bottom. All right. So as Clarence pointed out, we tried to make sure that it's clear. Go back, that you have total actual cost. The total actual cost means this is the cost for all of these different categories for all of your programs. The total PAMI share is how much you allocated or that was charged to just the PAMI program, and then the percentage should be a reflection of that. So remember actual cost, and that's why we changed the labels or the names of them. For clarification, actual cost is all costs. Total PAMI is just the amount that was charged for PAMI, and then the percentage is a reflection of that. All right, thank you, Clarence.
Thank you, Lisa. Moving on to the PAMI budget actual. Please, 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 this is very important. That's something we wanted to point out. You must have 2 decimal places for question 1. Does your P&A have approved federal indirect cost rate? That is very important. We put an example up here to remind you. Other than that, everything remains the same as it was last year. You have the option you must add your fiscal year. If you need to add another one, you may do so for previous years, and you can delete it. And also add a source name. Yes, go ahead, Lisa.
All right, sorry, Clarence. So go back up to the top. So when you're prepared, it's important to complete your budget first on that first form because this here is a summary of that. So PAMI expenditures, that should be, again, what you identify if there's indirect costs, but the total at the bottom on this first 1 through 3, 2, the indirect costs, and then 3, the total from your budget, that should be the same total that we see on the budget, including the indirect costs. And then the next one, do not, because we notice some people are dropping down this total into the next income source. This is your carryover only, any PAMI program income, any state funds that you receive or other source of funds that you receive that you use for PAMI. Your budget costs go in the top form. All other source of foreign funds, including carryover, PAMI grants goes in the second form. Thank you, Clarence.
You're welcome. Okay, moving on to the statement of priorities and objectives. This information will be ported over from the application, but once you get here, you can view your priorities, and you can also add your strategies and add an outcome as well. Once you can add your outcomes, whether it was achieved, not achieved, and the reasons why.
Just want to emphasize here that your statement of priority and goals and objective should be in the same order that they were approved in the application for FY 2023. If there were any changes that were not approved, it should have been approved by SAMHSA before completing this PPR. All right, thank you, Clarence.
Okay, I'm moving on to the Advisory Council report. Once you open this page up, you must download the Advisory Council report that I showed you earlier on the application dashboard. You also have the option to do it here. And this is what that looks like. Once you're done with it, you're gonna come and upload it here.
Go back to it, open it up again. We need to point out about the gender and sex.
Okay.
Okay. Make it a little bigger, please.
Yes. Got you coming.
Mm-hmm. All right. So stop right here on section A first.
Section A.
Okay. Please be mindful that this is the PAMI Advisory Council report that should be completed with clerical assistance from the P&A, but again, the PAC should be responsible for this report. Therefore, the PAC should be prepared by someone from the PAC or the PAC and not from a PAMI staff. Also, at the bottom, it should be the chairperson of the PAC signature, where it has here the signature. Let's go to the section on the sex and gender and sex. As you can see, as you can see, the same information for ethnicity, race, go down a little further, are parallel with what was added in the PPR. So we made it parallel in the ACR, the same information that's in the PPR. All right, thank you, Clarence.
Okay, if that is the application, do we have any questions before we move on to the?
Yes, we do. The first question we have, this is in regards to the tables that require you to enter numbers that should match up. Will we get an error message if the numbers that should match up do not?
No, you do not get an error message. There's no edit for error. That's why we're emphasizing and pointing out that to make sure that your numbers add up.
Okay, otherwise, how will we know?
Well, again, as we said, the forms, you're basically just repeating the information just in different forms. So naturally, the information should be consistent.
Okay. Referring to number of interventions on behalf of groups of PAMI eligible individuals impacted, is that information that was provided available as part of the instructions, or is that explanation written anywhere?
It's in the instructions. It's in the instructions.
Awesome. Okay.
Mm-hmm.
How will we know what data to collect going forward if we don't have a list of all the changes / new data that is required? Are we supposed to go through last PPR versus this PPR on our own to know all the changes? I think a list of all changes from SAMHSA would be extremely helpful, so that we are able to collect the data that you're requesting. I just don't think it's an effective use of our time.
As we said earlier, we will consider that thought and make the information available.
And those are all the questions that we have. Thank
All
you.
right. And that just for whoever comment that was, again, just please be mindful that the changes that SAMHSA implemented came from the PPR, came from the PNAs and NDRN.
Okay. And then here's another question. Is it possible to change the username of a BGAS account? This question, and I know, Lisa, you may have your own take on it, but all users should be using their very own account to access WebBGAS, and it should not be an inherited account that may have came from another resource. So that account
Correct.
should be your name.
Correct.
Yeah.
Every user should have their own account. We are emphasizing that you should not be sharing accounts. And when a person leaves the PNA and we've been notified, we are closing those accounts. We just recently went through it to make sure that everyone that has access in WebBGAS will be made this webinar will be made available to them. So if someone is on here because you received a link from someone else and you don't have your own account, that's the reason you didn't get it personally. But if you need access, please, if someone in your PNA needs access that does not already have it, please send an email to the assigned program officer. Again, the email should come from, we're asking that it come from the executive director so that we can verify that this is a legitimate request from a staff. Because unfortunately, we've had outsiders that has no relationship to SAMHSA or the PNAs asking for access to WebBGAS. So that's why we're asking that the request come from the executive directors to
Yes.
verify that it is legitimate.
Another part to that question, how will the historical data be available to a new account? And did you want me to take that, Lisa?
Yes, go ahead.
That historical data is tied actually to the state or territory and not to the account. So once that information is entered by whoever enters that account, that is going to go to the progress report. So that information will transfer over as long as it has been saved and it was submitted for the prior year. It will transfer over no matter which account made that save.
All right.
And then
So
one last question. Sorry, Lisa. Did you have
go
anything to
ahead.
add on to that one?
No, I'm good. We're good.
Okay. And then one last question. Is the afternoon session using the same meeting link as this link? No, it is not. There is a separate link for the afternoon session. However, the afternoon session will be covering the exact same thing. So unless you need more clarity, do not feel obligated to join the afternoon session, but it will cover the same exact thing as this session.
Yes.
And those are all of our questions.
All right. Okay.
Okay, moving along. Once you have reviewed your the progress report and marked everything completed, you're going to notice that this option is now available on the sidebar, P&A Supervisor Review. Once you review everything and everything looks correct, you're going to click P&A Supervisor Review and then Submit to SAMHSA. Now your application has been submitted. Now let's move on to the revision request. I'm going to use.
This is Michelle. I just want to confirm to everybody that only the supervisors can submit to SAMHSA. So if you're a user, you're not going to get that button. Clarence just has that because he has expanded access.
Okay. If the state finds that anything is wrong, you will receive an email saying that you have a revision request. So you will go back into the application on the sidebar and select revision request. Now, once you get here, you can select each one to see if you have a revision request on what page, or what I like to do is go to forms with revisions, and you will have them all right here for the revisions that must be made. So as of right here, we have one for areas of alleged rights violations. And on our description, you will have the reason why you need the revision. So we're going to view the form, select view form.
And also, I just want to make sure that everybody, you can print out each of these forms to see what has been added, what is new that you didn't have from last year. So each of these forms can be printed out.
Okay, to start the revision, you're going to select Start Revision. Then once you click Start Revision, you will be able to go in and edit anything that must be changed, that needs to be changed. So that is the only time you will be able to edit. Once you submit your application, you will not be allowed to change anything. So once you made your appropriate changes, you're going to save it. And you're going to select Complete Revision. And you're going to do that for every revision request that may come back. And you're going to get status as completed, it's done. And then once the state gets it, they're going to approve or disapprove your revision. If it's disapproved, you'll get another email. You got to have to start the process all over again. But that is all for the PPR progress report. All right, are there any final questions? How about you, Lisa? You want to close us out with anything?
Just want to say thank you to everyone for your time and attendance. Again, if there's anything that still needs clarification or you have questions, please feel free to reach out by email to your assigned program officer. If there's anything that we feel that need to, be explained to you in person, of course, we could set up a meeting with you as well as you could set up a meeting with us to go over it. Thank you so much and continue to have a good day. Thank you, Clarence.
Okay,
Thank you.
everybody. Thank you, Lisa.
Thank you,
Thank you,
everyone.
Crystal. You guys have a great day.
You too. Bye-bye.
Thank you. Thank you.
Bye-bye.